with Dr. Richard Gerardo from California. Richard is a chiropractic practitioner, and he got my attention after listening to a lecture he gave recently, and he was talking about a protocol he developed to treat people who are overloaded on the sympathetic part of the nervous system. And I'm very happy to have Richard here to have this 1-hour conversation. Richard, thank you so much for taking time and to participate in one more episode of Doctor's Talk. Doctor's Talk is something we started here in Switzerland, was first COVID related, and then we said, well, we also would like to show a little bit what's going on on other parts of the planet. As I worked in Africa for a couple of years, I also worked in Afghanistan. I still have good relationships with these countries, and then we also said, well, let's also talk about other healing methods, not just about what I'm interested in. So I'm very happy to have you as a chiropractic practitioner. Could you please start introducing yourself a little bit?
Thank you. I'm really excited about actually sharing some of this, because the reality is that since COVID, our whole world has changed, and I think if we don't join together, or at least pool our knowledge together, that it's like divide and conquer. So the whole premise is that I was working on before COVID, but it's become so appropriate for patients now, is how to downregulate the sympathetic tone, or how to balance the autonomic nervous system. And that really started 20 years ago, because I was dealing with TMJ, clenching problems, and working with dentists, and understanding that anybody that clenches is stuck in sympathetic. Anybody that's got a back injury and standing up against gravity goes into sympathetic. Anybody that's been psychologically traumatized or challenged, as the COVID scare did to everyone, whether we were going to live or die, whether the virus was deadly or not, and the unknown puts everybody in sympathetic. So that I was amazed at how much it's like the clientele or the patient base moved to what I was already doing, and not just TMJ patients anymore, but to everybody. And it's now everyone has been stuck in sympathetic since we've done this COVID thing, which has made me in sympathetic, because it's been so crowded and so much demand, because people now are searching for help that's not traditional, that's not mainstream, because there are no answers coming out of medicine. In fact, they don't want to give us the answers of what is really behind the COVID shot and what's wrong with the thing and all of the side effects and problems. So it's really, I feel like my time is now. I mean, it's like what I'm doing really is appropriate for where we're at in society and around the world. And along with that, I was already doing a lot of nutritional work, but the fact is this sympathetic problem is pretty much a holistic problem. So I've actually part of the protocols now is I start using some herbs and supplements to help downregulate that also, because people are getting so fatigued from being in chronic long-term stress or chronic sympathetic tone that they've lost the ability to rest and regenerate. So that part has to be supported. And so it affects everything, right? Once you're in sympathetic, it's actually depleting the energy for your parasympathetic functions, which is all your digestion, your hormones, reproduction, your sleep, all of your reactions that are subconscious, all breathing patterns, asthma, all the things that we've seen as part of the side effects of the COVID vaccine and the protein spike, are creating that, facilitating that, or promoting that sympathetic fight or flight tone. And so that's really where we're at now, and what we're doing is really using that basic protocol, that paradigm, to fit where people are at, because everybody's individual. So nothing is absolutely concrete or the same for everybody, but the starting point is all the same.
You know, I had a couple of months ago, I had a kind of insight I should have had already a long time ago, but the story is that about a year and a half ago, I got interested in a technology coming from France, and so I went to south of France to meet one of the top guys who uses a technology to connect electrodes with plants, and you can capture the electromagnetic signal from plants and you can transform that into sounds. So basically, the plants can produce sounds, and it's a very, very beautiful music, actually. Now, the reason I'm mentioning that is because in my break, the last patient who came in just before I went to my break at noon, I offered them to listen to this music. So I just connected the device and the loudspeaker with the plant, and then I walked out of the consultation room. I had lunch, and when I came back, almost everybody fell asleep. And then I realized, I tried it with myself, and I realized, oh, that's interesting. And almost everybody kind of described a change in their symptoms. And then I realized they all go in a parasympathetic mode, exactly the opposite. So that what you're saying fits perfectly into what I was seeing. And I'm deeply convinced you cannot heal when you have a sympathetic overload. It's just not possible. You stay in a too much tensed, defensed fight mechanism, and you have to reduce the tension to get into a parasympathetic mode. And basically that's what you're enhancing, right?
Yes.
Can we talk a little bit about a protocol you developed?
It's not that I've developed anything that no one knows, but everybody knows something about the sympathetic parasympathetic. People talk about it all the time in mass media, but nobody has protocols that are specific. And I know that your program there, that's not the only one that has relaxed people. That's what meditation is about, right? That's creating theta waves and different yoga and different exercise programs is to slow down your breathing, get you into more parasympathetic. But the idea is that once you've got stuck, can you come out of it without help, or do you need help? And that was my whole thing, is that I learned how to help people with hands-on chiropractic, and it's really craniosacral based, right? The craniosacral system moves the cerebrospinal fluid around the brain and spinal cord, and that rhythm gets altered in chronic sympathetic, and that's where I start, and that's where the whole thing starts from, which makes it easier for everyone else's therapy, including the one you're talking about, not just to work, but to hold, right? Because the system doesn't automatically go back to what it knows. It's now been reset into a more balanced state. And that's the key, is that the system's not stuck. The system's now been opened up, or lets go of that. So now when you do the things like that, the music or tones or vibration, now the system can resonate and let go because it's in a receptive mode, not in a rejection mode, right? Fight or flight is a rejection mode. There's no healing, there's no resting. You need to get a rest and regeneration.
Now, you mentioned that since COVID, people are even more stuck in the sympathetic overload. What are the clinical pictures you see? How does that translate clinically?
Well, first is people aren't sleeping right. Nobody's sleeping well. I mean, they say, oh, I sleep, but they're always tired, which means they're running high cortisol at night, which is the sympathetic tone, which means they're really light sleeping, they're not getting the restful sleeping, and that starts that whole process downward, right? So that stuff like, well, if I take my own example, as I told you, about 3 months ago, I had a really bad bout of asthma. I've had asthma off and on my whole life, but it flared up and it kept getting worse over about a 6-7 day period to where I couldn't sleep at night at all. And so now my asthma was out of control, and I was using an inhaler, and I had an inhaler I was doing 7-8 times a day, and it was just keeping me breathing. I couldn't function. And so luckily I had someone that could prescribe prednisone, and I actually had to go on prednisone for 5 days to bring it down again, because I had lost control, because I wasn't my own patient at that point, right? I had not taken enough precautions, and I was around too many people that had been shedding that protein spike. And so that was a real lesson that brought it home to me, how much I needed to be real clear and focused what people need to understand, what I was going to help them with, because of that real life experience, which is, I'm not the only one. I know this has happened to a lot of people, and I know that there are a lot of other symptoms and problems with that, but the breathing thing is such a common problem that everyone knows that COVID has caused, and the inflammation in the lungs and the out of control respiratory symptoms that just won't calm down. So that really, to me, is paramount for everybody to understand, so that we can move forward in the process of healing, because it isn't about me healing them, it's me helping their bodies getting to a point where they can heal themselves. So the sympathetic is the base of that.
So sleep disorders is clearly something that you observe more than before.
Oh, Yeah, that was for a while. It was like everybody came in and asking, "Well, give me that. What are you giving people for sleep? I want that," because were so many people that were so upset, so stirred up, so sympathetic driven by this crisis of the COVID, and so that was the whole thing with downregulating that nighttime cortisol just became part of the protocol, right? So first thing is do it structurally and then start doing it herbally or nutritionally, because the system's got to regulate to actually rest and heal. So that was the next thing. And then you get into some of the other stuff is the anxiety, the chronically upset digestive system. Well, if you're in sympathetic, you shut down parasympathetic function. So those things all get shut down, right? So that the constant chronic state is what the problem is. So that's the biggest thing for people to understand, is that you've lost control of your own system, because the entire cellular memory from this whole craniosacral system to your nervous system is completely altered and now needs to be helped or nudged back to that normal rhythm, which we've lost. And that's what you're talking about with all this vibrational stuff and the sound, is because that helps, is a resonance that gets your system into that state, which is really effective for healing and for balancing the system if you're not stuck in the structural part of this component that I have found to be so pronounced since COVID.
Well, we can talk maybe another time about the music of the plant, because it's something I'm really passionate about. It's just to maybe one thing to mention regarding that is that there seems to be an interaction between the plant and the person, and so you really have to walk out of the room, otherwise you kind of pollute the environment. So the plant kind of captures what's going on with the individual which is around, and it's so super sensitive. If you record it, actually can analyze. You can find protein chains which are encoded in the notes. So this has been discovered in 2016, I think. So it's very interesting that each amino acid basically is encoded by a note. So you have a C2 that's standing for an amino acid, and that resonates
Really?
then up like 18 octaves further up the chain with the amino acid. So there is some very interesting research done about this. But let's come back to COVID. So you mentioned sleeping disorders, anxieties. So people are overloaded psychologically. That translates into sleeping disorders. Do you also see people with more neck pain, back pain?
Well, yeah, you get a lot of structural inflammation, right? Because that protein spike is an inflammatory toxic protein. So to me, that's the shotgun, is that it'll irritate, inflame any system that is not very well regulated. So if you have chronic states of inflammation and or pain in the musculoskeletal system or in your spine or your joints, they'll tend to flare up.
Right.
But that's the same thing for anything, right? As I tell patients over and over again, this thing is like a shotgun. So there's no one symptom pattern that I can say is the absolutely the same, because it's just taking what's already wrong in your system or what's already out of balance or what's already weak, and it potentiates or makes that worse. So you can go from the hormones and the women that have lost their periods to the chest pains and the heart problems that are causing heart attacks. They're showing that there are weaknesses in the system that just got inflamed and got worse. And that's what we're trying to reduce, right? Is the impact on those imbalances or those weaknesses.
Right. So I perfectly agree. I mean, the spike protein basically amplifies pre-existing conditions, which is actually not that difficult to understand from a physiological point of view. If you study a little bit what the spike protein, where it interacts, which receptors it interacts. Now I'm very surprised about let's say the attitude and the positioning of the medical world regarding the vaccine, because the vaccine basically provides information for the spike protein, and the idea was that it stays local, and then like in the muscle where it's injected. And now we know it's not the case, and there is a lot of data out there that it's not staying local, and then it's going systemic, and then it's produced systemically, and of course then it's becoming very toxic. So what do you observe in your daily practice with vaccinated people?
So that was what I was saying, is that I try not to limit what I'm looking for, because it can relate to anything. I've had dermatitis and eczema flare up. I had one this week that had the chest pains, and he had the shot over a year ago, has not had any health problems since the shot. It's been like 15 months since he had the 2 shots. And 3 weeks ago, he started having chest pains. So at first I was like, is this from the vaccine or not? This is a protein spike inflammation, but it got worse in this last 10 days ago. We put him on some enzymes and did some stuff for break down the protein spike, and the chest pains went away. I had another one just recently where I've been 5 months trying to get the regulation on the period and the cycle to come back to normal, and it's taken 5 months to get her to have her second cycle start again. And it's not what everybody says, that the protein spike is attacking the organs and reproductive organs, and I didn't find that on this one. This one I did all the work that they say to do, and it ended up being the brain. It ended up being the hypothalamus and the pituitary. And there's nutrition and supplements for that, and that's what I did, some of the cranial work, the craniosacral type of work, and I gave her the nutrition for it, and that calmed down her system so she could start regulating hormonally again. Because again, when you go into fight or flight, reproduction and sex hormones are secondary functions. They're not in part of fight or flight. So when that doesn't come back online, then I know I have a serious problem that's there's a chronic inflammation or a chronic toxic substance that is creating a constant insult and a constant dysregulation in the system, which has to be neutralized, which is what I'm doing with the herbs and the nutritional stuff, because it's a multi-tiered effect, or multi-tiered approach. There's no one thing to fix this.
Mm-hmm. Do those people who are vaccinated respond differently to chiropractic methods, or don't you see any difference compared to those who are not vaccinated?
The vaccinated patients that are symptomatic, so there are ones that are asymptomatic and ones that are symptomatic. The ones that come in and they have some issues that they think are from that inflammation or from that protein spike, are tougher patients. They take more of a holistic approach. I said, so usually it's nutrition and herbs with the treatment to get the system to rebalance. If they're not having any symptoms and they seem to be stable in the state they're in, then they're pretty much reacting the same as other chiropractic patients, because they're not in a flared state. And I just repeat myself, but that whole thing is a shotgun effect. It attacks the system, but it doesn't seem to be immediate. There seems to be delayed reactions. I mean, the one he didn't have any problems for over a year, and I've had several of those now that they just took a while for the system to wear down or to express out or to become symptomatic. And when it does, then it's much more difficult. If they're not having symptoms, they don't seem to be any different than anyone else. So is that related to the fact that the COVID shot did not move systemically? Is it because it stayed local? I don't know. Those things are still an unknown. I mean, so it's still to be determined, I guess, as I can say, because I can't give a clear answer on that part of it.
Right. Richard, let's talk a little bit about the media. Even if you and I were medical professionals, but let's talk a little bit about the media, because the media were the main driving force of creating a lot of fear and anxiety. And I can tell you, I have had people coming in at work with 2 gloves, 2 masks, the head covered, right? They were so fearful, and of course, I mean, this massively overloads their sympathetic system. So I mean, I was just surprised to see how destructive and counterproductive the media can be and how health damaging, basically.
I agree with you. I mean, and it was before COVID. I mean, if you look at the lack of reporting on the problems and the side effect of the vaccines previous to this COVID shot, it seemed like it was already in play to cover for the vaccine industry and the pharmaceutical industry that they don't have any problems, but yet we had major issues with different vaccines and side effects, and the increase in problems with all the autism and the learning disabilities and the statistics that go with it, which I don't have in front of me right now, but are just staggering how much more problem that the kids that are vaccinated are having than the ones that don't. And in fact, there's new stats now that I just read about, that the pediatricians that are keeping track of the kids that didn't come in for their vaccines while the COVID crisis was on, so they missed all their suggested or required vaccines because everybody was worried about COVID more than anything else, and the kids' health was better than the ones that made it in for their vaccines. So that's pretty interesting that,
wow,
that's not being covered by the media, because the narrative is so much about the co-opted effort of the government with pharmaceutical industry that we've lost perspective on what really the truth is, this stuff, and so it's all a narrative now, and it just drives me crazy that the information that patients are gathering, if they're watching the media and not looking on online sources that are more not the sources that are not driven by money and advertising, that they don't get the full picture, and then they do come in scared. They do come with the mask, and I don't have those anymore. That's not my clientele or patients anymore. They really have decided that I'm not the guy for them, because if they're holding on to the fear and they're still worried that what this is going to do, I'm past that point where I have any concern at all. And I think that, what is that old saying about there's nothing to fear but fear itself? And we have to stop acting out of fear, or we're never going to come back into being healthy, and that we're going to be manipulated or controlled by our fear. And I have no fear, reservation, or concern anymore about what they've done. It's just about keeping the system healthy, right? If you have a healthy immune system and you have a good diet, you get sick, you get over it, it's not a big deal. It doesn't affect, and the statistics show that, and that the shot is way more, the side effects of the shot are much more devastating than the virus itself. The cure is worse than the actual problem. So.
Yeah, you're very comfortable talking about that, and
yes,
that's great. I really appreciate that. Did you run into any trouble speaking out that the way you're doing?
So far, no. No, I've not had anything that has been a threat or a problem. And I think here there's so many people now that are looking for someone who doesn't follow the mainstream narrative, that's now basically, that's the only people that come see me now. That's they're looking for someone now. They don't want the classic medical establishment kind of advice, because it's the same repeated script that doesn't answer any questions, and people want answers and they want to ask questions, and it's not been a problem for me. I've just decided I'm not going to worry about it, and it hasn't been. So I'm just moving on with my life and doing my career the way I want to do it.
Yeah. But in California, as far as I've heard, things are getting more and more difficult for the doctors, right? So they speak against what the medical association, or I don't know, the politicians or the California's medical opinion is, and they get easily into trouble, right? Is that correct? There are even laws that have been will be applied.
That was a bill that Newsom signed, which has now been challenged and has been appealed in court and has been stayed. So they can't force anybody yet to not talk about it, because it's been challenged as a violation of our freedom of speech. So a lot of this stuff was and is promoted like it's already gospel law, and it's not. It's the media again promoting this narrative that's not really true yet. And so that particular law, it really applies to medical doctors not to chiropractors, because we're not under the medical board.
Right.
So the chiropractic board hasn't been challenged yet. So it hasn't changed. We don't have to have an opinion, because technically, by law, I'm not supposed to be. I don't tell people not to take the vaccine or take the vaccine. I don't tell them to take a drug or not to, because it's not my scope of practice. So I'm talking as a nutritionist and a chiropractor about the health effects, not whether they should do it or not. So that I'm not interfering with the fact that they're taking or not taking it, because that's not really my scope of practice to begin with. So I kind of think we're clear of that kind of part of it because of that. But I think this legal problem, this challenge that they've done legally, is putting things on hold, and I don't believe they're gonna win that, because it's taking away the doctor's freedom of speech. How do you take a doctor and tell him he can't speak his truth? So I think they're gonna win this one from what I've read, but we'll wait and see, because we can never tell.
Right. Let's come back to your chiropractic practice. So you developed a protocol, a specific protocol to get people out of the sympathetic overload. What precisely are you doing?
It's a technique that involves the whole craniosacral system. So it's not just classic chiropractic, it's other therapies. So the craniopathy or the cranial techniques are to regulate or balance that whole cycle of the craniosacral system. And that, if people don't understand what that is, you need to look it up, because it's a whole different system of health. I don't say system of health, but part of our health that medicine doesn't really recognize. And in California, I have a lot of doctors that I've gotten referred to because of the fact that I do this cranial therapy and work on the craniosacral system. And it's not practiced by most chiropractors, but it's well within the scope of practice, because I do adjust and I'm a chiropractor, but that extra therapy is what has become the key and the baseline to balancing that. And it's not that, like, your therapy doesn't work to bring down the sympathetic tone. It isn't that chiropractic and the adjusting doesn't bring it down. I'm just targeted on that, is how I focus. Everything I do is to do that, so that's the greatest effect I make, and has been the most significant impact to patients, because it's the relationship of that craniosacral system to the nervous system and to the musculoskeletal system. So the musculoskeletal system, if you cannot stand up against gravity without pain or instability or a lack of balance or a loss of core or core stability, then your body tightens up. Muscles try to make up for the ligaments that have been compromised or weakened. So the whole thing is, that's the chiropractic part, that you have to be have more structural integrity, because the less integrity you have, the more instability you have, the more balance issues you have, the more your postural muscle system, including your clenching muscles in the jaw, which is key to this, is that they will tighten up and the body can't let go, because anybody that clenches is in sympathetic. That's a fight or flight pattern. That's part of what clenching is. But we, in this modern society, don't have a break from it. It's a constant. If all the stimulus, all the electronics, with all of the constant news cycles, and then with the deterioration of our environment, increased, the pollution and the compromised food, it's all contributes to the body being out of balance and the body being in a state of stress. And it really where it came from was really that the French physiologist Selye, I was given his book and a poster back when I got out of school 38 years ago, and he always talked about the physiological reaction to stress. And for years I found that really interesting, because he talked about the breakdown of posture was the reaction to stress. And then he got into the whole thing of the breakdown of the hormones and the osteoporosis and the water retention and the muscle atrophy were all part of this reaction to stress. And that reaction to stress was the sympathetic. So he talked about it and did it back in the 70s. But medicine has never done anything with it. So it's one of the posters I actually keep in my office to show patients, like, look, this is not what I didn't invent this, I didn't start this, I just added to it. That I took what was already existing, that people were doing and kind of understood, but didn't approach it as a primary focus. And I turned it into a primary focus of treatment.
Yeah, that makes all
Did I
perfectly.
answer the question? I get that.
Yeah. It's very interesting. It makes perfectly sense. Now, are there special points you treat, or is it the whole back, or is it the whole skull, or how can we imagine what you're doing technically?
Well, you're understanding. The first and primary thing to understand is this whole craniosacral system moves cerebrospinal fluid around the brain and spinal cord. And because there's a blood-brain barrier, the blood does not go to your brain. It has to travel through the membrane system. So the whole thing is regulating the movement of this cerebrospinal fluid. And that's not just me, that's osteopathy. There are other chiropractors, there's craniosacral therapists that all do this kind of similar kind of work on this craniosacral system. So that's what I mean when I add that into the chiropractic part of it, so that I'm using that as part of the premise, because I want to treat that as well as the loss of core stability, the lack of ligament integrity, the damage to the discs and the weight-bearing structures in the body, and which it can include, the knees and the feet too. If you can't walk without pain, your body goes into a guarding pattern or into stress, and that stress becomes a chronic sympathetic. So if you're in a chronic pain pattern, that's the same thing to me. That will create the chronic sympathetic tone. If you've had a long-term injury in your foot or your knee or your hip, that a herniated disc or sprain of your low back is the same thing. So it's all part of that same thing. And part of that's because we have so much stress on us environmentally on all levels. So that, that's another whole, we can get into all how many things that we have that are stressful that we didn't have 60, 70 years ago, that our grandparents didn't have to deal with. So that's why it's become really easy for me, because it's so common. It's everybody, because the world's changed.
Richard, in the U.S. healthcare system, you have any idea about how much what's the economic weight of the chiropractors within the healthcare system? So you're treating a lot of different conditions. Are there any numbers out there of what's the impact of the work of chiropractic practitioners is compared to, let's say, the conventional doctors and the hospitals and the those who have their private clinics? Do you have any numbers? Because we have chiropractic practitioners here in Switzerland as well. We have something which is even, while we have chiropractic practitioners, we have osteopaths, and we have also craniosacral therapists. And it's increasing in popularity, I must say. And I always enjoy these conversations with chiropractors and osteopaths, because I think they are very, very, very skilled people. And my brother-in-law, for instance, he's a physiotherapist, and when I talk with him, I'm always really impressed. I mean, how first of all, how passionate he is, but how much I can learn from these professions.
Well, my favorite saying when people are talking like this is like, yeah, those of us that are doing this hands-on work, craniosacral therapists, osteopaths, chiropractors, physical therapists, we're doing physical medicine. Physical medicine, that's really the healing art, or that's practicing health, because you're dealing with injuries and stress to the body, where that is not what medicine, the big pharma and the government are measuring, right? One of the best examples of that is back, I don't know how long ago it was now, 15 years ago, I think, maybe. We had a change in the governor in California, and they basically compared the stats on the work comp injuries, the work-related injuries. And all of this data showed that comparing diagnosis, chiropractic treatment was cheaper and more effective and had less time off work. But yet, the political system was that they basically shut down the access to the work comp system, the healthcare of workers, to chiropractic. They really severely restricted it. It had nothing to do with the data or the statistics. So at this point, when you ask me that question, it's like nobody wants to know them. I mean, the system doesn't want to know them because the lobbying, the politics, the money that gets affected by that is not one that is profitable for big business. So there's not that emphasis for something that decentralizes control of healthcare and not centralizes it. So no, there's no real data anymore comparing the two. But you can find it. That whole work comp thing in California was huge.
So you say that was all very positive, and yet things have not been developed in a way that people have more access, and this could be could play a central role in public healthcare, or in public health, basically.
Yes. Mm-hmm.
There's no political
I
support.
said just follow the money, right? That's all I keep saying to patients, follow the money. Those that have the most influence are the ones that have the most money to leverage the system and to lobby with, right? That's really what it's become. And I think COVID has shown us that, because how do you have a vaccine pushed through the system that's never been trialed or tested, clearly, and then you're supposed to sign what? An EUA, an experimental use authorization, so that you're now the trial in the experiment. So if anything happens, it's on your own. And the fact is that means that they don't want to have to prove their therapies, and they don't want anything else to question their therapies. They just want to be able to put them out there, and then we pay for them. And that's, the side effects are our responsibility. And it's not, it just shows how skewed the system has become, because it should have taken 3 or 4 times as long to clear this vaccine through all the trials and safeties, and there was nothing done, and no one's held responsible, and there was huge profits made. I mean, how many billions of dollars was generated from around the world for the pharmaceutical industry? It's unbelievable. It's unfathomable how much money was made.
Why? It's very troubling. It's extremely troubling, I would say. Richard, I've got a question. When you have got patients with, let's say, psychological issues or even psychiatric patients, and you do the hands-on work, as you say, so the physical therapy. What do you observe on the psychological level with people, especially in regards of somatization?
There is a calming effect, and this is, I think this was done by the New England Journal of Medicine back about 15 or 20 years ago, of how much psychosomatic effect chiropractic and hands-on medicine had on people, meaning we get the benefit because we touch somebody that they think they feel better. And they were saying that it was really a problem, that it was blocking people's opinions that medicine had the answers, and it was basically an article saying that, how much people ran to these unproven techniques because it made them feel better. The key being they wanted something that made them feel better, not what the doctor said to do that didn't make them feel better. And this thing of your music and tone, and that's the same thing with what hands-on does. When we are touching someone, there is a neurological, energetic reaction, exchange with the other person's system. And if you're going to someone who does the healing arts, then they're there to help you feel better. So people automatically know, if they have someone that's reputable and has helped other people, that they know they're going to get help. So of course they change and improve. So how much of those psychological states really improve? That's really impossible to measure, but do they get affected? Yes. And one of the simple ones, or one of the ones that are the most dramatically responsive, the ones that are in high anxiety. Anxiety is just a sympathetic, a reaction of the sympathetic overload that has hit terminal. Now you're anxious all the time, because when you're in sympathetic, you're looking for, where am I going to get eaten? Do I need to run away? Do I need to fight myself? But if it stays chronic, now you're just anxious, looking for the problem, and then it becomes a chronic condition of anxiety. And what is it? They're saying 1 out of 6 teenagers have clinical anxiety. So what's creating the anxiety or the emotional instability? Okay, so I'm not going to say I'm the expert and I have all the answers. I just know that when I treat that, they seem to respond not 100%, but relatively well, and positively, and some mild and some very significant will a lot from that. And I wouldn't want to get into a lot of the other psychological conditions, but anything that's the system's depressed or anxious or out of balance, by bringing them back into balance or downregulating the sympathetic tone, they emotionally feel better. I didn't mean I fix the emotional state or the crisis, the spouse that died or the divorce or the things that are going on, but they can handle it better. Because that's, again, back to what is Cellier's work, is what's the biological reaction to stress. If I improve that reaction to stress, you're coping with stuff better and emotionally you feel better.
Right. I actually do not believe at all that just the physiotherapists and then all the other techniques and the craniosacral therapies, they have a kind of just positive impact, as many people believe. No, I mean, these are some techniques that are very powerful because they basically support the body to evacuate the stress, and they somatize. They allow the patient to somatize, to eject the inner tensions and to bring it out. And I think we should not talk in terms of energy actually anymore, that people evacuate their energies, etc., as many people do here in Europe. But what I believe, and I'm very convinced about it, is that if we think about the human body as a thermodynamic system, as we are basically made of water, and we're organized in such a specific, highly self-regulated way, I believe that what you're basically doing with your work is that you support the export of entropy. I had a long discussion with a French chemistry professor. He wrote an article called "The Thermodynamics of Life." We're gonna put it online because then he filmed it all. It was a 5-hour interview we did in south of France, and it was all about his article, "Thermodynamics of Life." And I think what you do, if a skilled chiropractor really manages to approach a patient in an artful way, what he does, he massively helps the patient to export entropy. And then the whole system gets reorganized. It gets reorganized, and of course that has an impact on the psychological level, on the emotional level, and all the other systems, body systems. Does that somehow make sense to you?
Yes. Well, and it goes to that whole thing of how acupuncture works in the movement of energy in the meridians, and how they unblock energy or they help regulate the flow and it balances the system. But it's to me, it's all, we're talking in different terms about regulating the system, and that ultimately it's can you balance the system, whether you want to call it energy, the nervous system, or the emotions, psychology. Can we create homeostasis? Can we facilitate homeostasis? And then all those symptoms, emotional, not emotional, doesn't matter, down regulate or balance or get better. So yes, I agree with you. So
Richard, when you take care of people, or do you have people you're taking care of over years, those who come in, let's say, since 10, 15 years, do you have these clients?
Yeah, I've had them that long, yes.
Yeah, that these people age differently?
From before COVID and afterwards, are you talking about? Or?
Yeah. Compared, let's say you have a 70-year-old patient who does chiropractic since 15 years, and you see them, I don't know, twice a year. That they
do we help the reaction to stress and aging?
Yeah, exactly.
Yes. And one of the basic premises that I try to educate patients on, which I will stress here, is that I really do think that if you want to stay youthful and healthy, that you need to work on your posture and making an erect, standing an erect posture and sitting erect. Because we can show that when you collapse posture, when you get into the bent over slump position, you're compressing first the lungs. And they've shown that the old man that has the collapsed posture and needs a cane and can't stand up straight versus the guy that stands up straight can lose up to 30% of his lung capacity. And that's just how you're affecting the lungs alone. So yes, I see that, in that they feel more energy, they feel more vital, they feel more rested, they sleep better. Those are all things that are primary focus that mean they're slowing down their aging process, their breakdown process, and that they actually feel better. Absolutely.
Well, that was very, very interesting. I think we should do a second interview at some point. I see this
That would be great.
I see this as a start. I would have a long list with other questions, but it's midnight here in Europe, and I'm still having this quite nasty cough. It's bothering me since a while. So I thank you very much for having taken the time. It's Sunday today. It's what time now in California? It's 3 o'clock.
Yeah.
Yeah. So
Yeah.
if you can imagine that we do something maybe a second time, let's see what the feedbacks are after this interview. Have you ever given seminars or lectures here in Europe?
Yes. Yes, I have. Yeah, but nothing since COVID. I've attended a couple and given a couple of short lectures, but I've not done my own workshop or seminar since before COVID.
It would be really interesting to bring you over at some point and to have a group of 50, 60 chiropractic practitioners who can think about it. Let's see how
I would
people
love to.
react
It would
it.
be fabulous.
Yeah,
I would love to have the whole healthcare system move towards this sympathetic model, and that was our primary focus.
I would
be
love
really
to be. I would love
great.
to be in your seminar. That's for sure.
Okay, thank you.
Thank you so much, Richard.
I look forward to it.